for it, TV. The world is thinking.
I'm wondering, there are many, many people in this country, maybe a small but certainly persistent minority, who would prefer single-payer health care. And I'm wondering why neither campaign is proposing that. And I know Senator Obama has said in a perfect world he would, but he wants to start somewhere else. Can you explain why not single-payer?
Well, I'm not the author of Senator Obama's proposal, but I think it's a very good proposal. When I look around the world at different advanced economies in this world, in Europe, in North America, in the rest of the world, I see many different models of health insurance coverage. I see some that are single payer, like Canada, where there's basically a single government health insurance entity that covers many of the costs of health care, but not all of them, and still has private insurance to supplement that. I see other models in the United Kingdom where there's a national health service that actually provides the care to people. I see Germany with multiple plans competing with one another that are basically managed by a coalition of employers and labor unions. And it's a very effective system. I see France with government-sanctioned but kind of mostly quasi-public, quasi-private administration of these health insurance programs, and a large private sector in health care. And so I see all of these different models. I don't think there's a single terrific one out there that we must adopt to achieve the goals of affordable coverage for all Americans, control over the growth in our health spending, and providing quality care that actually improves the health of people who interact with the healthcare system. I think we can achieve that in many different ways. I think Senator Obama's proposal is a very effective way to set that process in motion.
And Professor Kessler, why not single-payer in a McCain administration?
Well, I think the reason we don't have single-payer insurance in the United States is the majority of people who live here don't want it. If you survey people, well, whatever our friendly audience members would like to add. Unfortunately, the facts are otherwise. If you survey people and ask them, are you happy with your medical care the way it currently is, the vast majority of people respond yes. And were you to replace the current system with single payer, there is some possibility, not necessary, but there is some possibility those arrangements would be upset. And so the people who currently have employer-sponsored health insurance, the majority of them, do not want to lose that insurance. Indeed, this is something that both Senator Obama and Senator Clinton learned from the experience in 1993 when Senator Clinton, with President Clinton, proposed a massive overhaul to the nation's health insurance system. And the reason it fell down is because people did not want their current arrangements upset. And that's why it's just not in the cards for this country.